The My Health Matters folder supports me to prepare for my health appointments. I want to talk to Dr. Kerry and the nurse about my new medication. I plan to tell them I want to know more about it. I fill in the easy read pages about my medication. I move those pages to the front of my folder so they are ready to use in my appointment. The easy read health information keeps things simple.
Okay, hi Brody. Thanks a lot for coming in today.
I show Dr. Kerry information all about me and my health. Would you like to have a...
I would love to have a look. Thank you so
Sure,
much.
no
Yeah, it'd be great to go through this together.
Sure. Once Dr. Kerry has read it, she asks me questions. This makes talking to each other easier.
Thanks for showing me this page about speaking up with my health workers. Maybe you can take me through what it means to you.
One of the pages I really like is how to support me. This helps my health workers know what changes to make so I can really understand and be involved in my health appointments.
In terms of whether it's yes or no or not sure and those sorts of things. Okay, that's really good to know. Thank you. The My Health Matters folder is a go-to guide for person-centered care in my work. I explain the benefits and suggest the folder to people with intellectual disability, also to any person who can be supported to communicate and take ownership of their health information. Brody's folder, for example, has a part about health choices. Brody has showed us this part and made it clear he makes his own health choices. Understanding this now, we always ask Brody about his health decisions.
I feel more confident going to health appointments with my folder. I point at the tools in the folder. One of the tools is I have these feelings today.
Would you mind pointing to one of the faces to show me how sick you feel today?
I'm feeling about that one.
Okay, well maybe we'll have a look into that a bit further for you.
This makes it easier to talk about my feelings. Also, the notes section at the back helps me remember things I want to mention to my doctor. I have written in my folder that at health appointments, I don't feel comfortable saying the words yes and no.
So Brody, we had a bit of a chat about maybe having a blood test to see why you might be feeling unwell today.
I say no by showing a thumbs down.
Would you be able to show me if you're happy to go ahead?
I say yes by showing a thumbs up.
Okay, that's great.
And I say I do not know by shrugging my shoulders.
Brody, how are you going today?
Yeah, not too bad.
Yeah, I know you're here for a blood test. And great you've got your folder with you. Brody's engagement with his own health has improved since starting to use the My Health Matters folder. Before, even when he was unwell, he didn't want to go to health appointments because he was scared and not confident to speak up.
The different options that I have when I have things like a blood test.
Okay. Brody is doing much better now and seems much more relaxed after using his folder to show us what to do and what not to do. We now understand Brody is afraid of needles and take extra time to plan with Brody for blood tests. Can you give me a thumbs up while I'm taking the blood to let me know you're okay? And if I see a thumbs down, I know to stop and just see how you're going. I understand now how to let Brody lead his care because he has shared with me how he says yes, no, and I do not know.
I know there's a lot of my personal information in my folder. I only share the information in the folder with people I trust, like my doctor. I keep my folder in a safe drawer at home. My folder supports me to communicate, feel heard, and listen to. Health is a human right.